So the second of the series is focusing on food systems, methane, and health. We have 4 terrific speakers to talk about different dimensions of this intersection. We're presenting this briefing in connection with a series of reports that GCHA published several weeks ago, looking at the health benefits of mitigating methane in the 4 key sectors, the 3 key sectors in which emit methane, which are the energy sector, the food sector, and the waste sector. We will hear from our presenters. We may or may not have time for 1 or 2 questions. Again, we wanted to keep this briefing quite brief. So if you have questions along the way, please feel free to post them in the chat, and our presenters will attempt to respond. And also, I'd like to invite everyone on the call to introduce themselves in the chat, your name, your organization, the geography that you're from. And so without further ado, I am going to turn over to Amanda Quintano, who is the Climate and Health Technical Lead at Apt Associates. Apt Associates were GCHA's partner to produce the report series that we published. So over to you, Amanda, to talk about our reports.
Thanks, Jenny. I'm just going to share my screen, so I want to make sure that everyone can see. So as Jenny mentioned, I'm Amanda Quintana, and I'm with Apt Associates, the Climate and Health Technical Lead. I'm just going to chat with you all today about the findings from our food sector report on methane and health. The food and agricultural sector is made up of agricultural waste burning, rice cultivation, livestock enteric fermentation, and livestock manure, and it accounts for approximately 45% of anthropogenic methane emissions. In addition to specific agricultural sources of methane production, land use emissions from expansion of croplands, slash and burn techniques, and decomposing of biomass represent an additional challenge. The impacts of agricultural land clearing are especially pronounced in the rapidly growing global south, where vast carbon sinks, such as rainforests, marshes, and peat bogs, are grazed for livestock, food crops, and palm oil production, increasing emissions and removing existing sources of carbon and methane storage to the atmosphere. Food and agricultural production produce not only methane emissions, but release other greenhouse gas emissions, as well as contribute to ecosystem loss, net soil loss due to erosion, and a decline in biodiversity. Some health impacts covered in the sector report are as follows. Localized health impacts of methane exposure from agricultural activities occur primarily via tropospheric ozone, which contributes to increased incidence of asthma, respiratory illness, cardiovascular diseases, and premature death. Inhalation of such methane and associated air pollutants in smoke generated from crop debris burning as well as land clearing activities contain black carbon particulate matter, volatile organic compounds, better known as VOCs, such as benzene and formaldehyde, and many other gases and aerosols, all of which exacerbate respiratory conditions and affect children's lung health in particular. Livestock production and manure management creates exposure to air pollutants and odors that contribute to zoonotic infection and disease and manure pollution via water pathways. Finally, reduced consumption of meat and dairy diets provides a co-benefit and can improve human health and nutrition, especially in populations with high cholesterol, obesity, diabetes, and heart conditions associated with high meat and dairy consumption. So the report covered some ways forward outside of covering the health impacts of methane in the food and agricultural sector. And to achieve meaningful methane emissions reductions, systemic changes must be made to the food system that include agricultural production. So this slide shows some of the suggested ways forward in our report under the food sector and methane and health report that's broken down by local, national, and international level. The health community ultimately should advocate and support agricultural sector methane mitigation strategies by communicating with policymakers and keeping local authorities and the agricultural industry accountable. Luckily, most solutions for methane reduction are simple and cost-effective and can result in land conservation benefits, emission reductions, and improved health outcomes. If you have any questions, please feel free to ask me in the chat. Thank you.
Thank you, Amanda. Okay, we'll now move on to hear from Dr. Francisca Soto Aguilar, who is the president of the Chilean Society for Medicine of Nutrition and Prevention. And Dr. Soto Aguilar is going to speak about the importance of national dietary guidelines. Francisca, over to you.
Thank you, Jenny, and thank you everyone listening. Today I bring you this subject of national dietary guidelines as a tool for achieving healthier and more sustainable diets. I will bring up our national dietary guidelines and hopefully take some messages from it to improve other dietary guidelines that many of you may be involved in. As you probably know, the main contribution to mortality risk by risk factor are dietary risks, including diets low in whole grains, beans, nuts, and seeds, and high in processed meats and red meats. In Chile, our diet is very high in meat, sugar, and dairy. On the left-hand side, you can see that we are broadly surpassing the planetary health boundaries in these three food groups, according to the Eat Lancet Commission recommendations. And on the right side, something important for me to highlight is that regarding dairy consumption in Chile, most of it does not come from liquid milk, but it does come from cheese. And fatty dairy, such as cheese, is the main source of saturated fats in the Western diet. So this is also something important to consider when talking about dairy in our country. Regarding the food groups with the most efficient intake in countries such as Chile are nuts and seeds, beans and legumes, and whole grains. So when you think that a national dietary guideline has to have key, short, and easy to understand concepts, be strongly evidence-based, adapted to new knowledge, and prioritize health problems related to the country's diet, these are three key messages that should be very clear in our dietary guidelines. Our dietary guidelines are new. They were just renewed this year with an added environmental perspective. So as I said, I'm going to bring them up to you just as an example of things that could have been, in my opinion, done better, and maybe some bring to work key messages for yourselves. First of all, this guideline continues to have messages that are counterproductive, such as fish as the only source of omega-3 and dairy as the only source of calcium. In that way, to add other sources of omega-3 and calcium facilitates a diversification of the diet, an increase in dietary fiber, a reduction in saturated fats, and moves forward to a more sustainable diet. Secondly, in this guideline, there is no message or recommendation on intake of whole grains, nuts, or seeds. To recommend an increase in the intakes of these food groups is key to people's health because consumption is very low. They're also a key source of nutrients and usually replace refined grain consumption. Thirdly, among the 35 recipes given, only 6 contain beans, even though there is a message saying eat beans as many times a week as possible, and the intake is very low in the country. On the other hand, 23 of the recipes have meat, including red meat, and or cheese and butter. So I think to add recipes is a very good idea, as long as they represent the guidelines recommendations. Fourthly, an advice is given on reducing ultra-processed foods, but there is no mention to any of them in particular, not even the most consumed in Chile, which are processed meats and sugary beverages. We should always advise their intake reduction in a specific and explicit manner, especially regarding the most consumed, as I mentioned. Fifthly, when dairy is mentioned as a big and important food group, which in this case it is, not all food guidelines mention it as a food group, but this one does. There is no mention on saturated fat content of cheese nor any fatty type of dairy. So if 2/3 of the dairy eaten is cheese and much is butter, advice has to be given regarding their intake reduction for health. A take care of your planet message is added in this guideline, but without mentioning any food or eating action that can help to actually take care of it. So I think that if this is a dietary guideline and the environmental impact is to be considered, eating and food actions have to be mentioned. Plant-based diet as a concept is not mentioned once throughout the whole guideline. This concept is the most utilized and known among health authorities to refer to healthy and sustainable dietary patterns, and it facilitates the understanding of the people, of the matter, and the solution, so it has to be mentioned and explained. Lastly, we should address the elephant in the room, as the big food industries and their incidence in the dietary guidelines for the people happens in this country and in many others. I think food industry's commercial targets should not interfere with the national authorities' professional recommendations for health of the people, and this problem should be acknowledged and addressed. Thank you so much for your attention, and this is my email for future comments or questions.
Thank you, Dr. Soto Aguilar. Very important message, and a really great area to be working on. Okay, now I would like to turn over to Dr. Anandita Patnaik, who is the Policy Officer at the UK Health Alliance for Climate Change. And she's going to speak to us about advocacy for policy improvement and an open letter to the World Organization for Animal Health. So Anandita, over to you.
Yes, hello everyone. Thank you so much for the introduction, Jenny. I do not have any slides, but I will just share my screen to show the said letter, and I've also shared a link. So this is the website of the World Organization of Animal Health, which is an organization that says that its main aim is like the protection and safety of animals, but at the same time, it also says that we need more than 70% additional animal protein to feed the world by 2050. So we came across this page a few months ago, and then we are trying to coordinate an open letter to the World Organization on Animal Health, basically stressing on the fact that, like as this methane report, the findings in this methane report suggest that there's more than one third of the global greenhouse gas emissions are due to the food systems currently around the world, and why we need a transition from more animal-based agriculture, production, and consumption towards a more plant-based diet. So we've written a letter, and it has like highlighted all the importance of why we need to make the transition, as well as we've also taken into consideration that it won't be possible to do this everywhere at this point of time, taking into account the difference in like equity and the social justice aspect of it. But then there are countries like rich nations who have the capacity and ability to do it right now, and they should like demonstrate leadership. But in order to influence these policies, we would need global organizations like the World Organization on Animal Health, which is an intergovernmental organization, to have the correct guidance up on their website, and it should be in alignment with what the scientific consensus is on. Yeah, so that's, and yeah, we're hoping that we can get as much signatories on this so that it is more impactful. Yeah, I'll also share the link. I don't know, like Jenny, like how it would work. Would you be sharing the link, or?
If there's a link available for sign-on, this would be a great group to share that with. And if you don't have it accessible now, we will certainly share it with this group after the briefing.
Okay, I do have the link. I can share it in the chat, and it would be good if it could be shared later on.
Fantastic.
Yeah.
Thank you.
Thank you.
Thank you, Dr. Patnaik. Okay, our final speaker today is Vivian Madueke, and she is the Program Coordinator for Climate and Health at the Global Alliance for the Future of Food. And she's going to speak with us about a couple of initiatives underway to tackle food system transformation in the context of international policy making, such as COP, and the kind of transformation we need to see in our food system. So Vivian, over to you.
Sure, thanks, Jenny. Hi, everybody. As Jenny mentioned, I work for the Global Alliance for the Future of Food, which is a strategic alliance of philanthropic foundations. And I'm here to talk to us about all things COP, what is happening around food, climate, and health around COP, and also a report that we're bringing out in a couple of days' time looking at fossil fuel dependency in the food system. So the good news is that food is high on the agenda this year. The COP presidency this year highlighted food as one of their priorities. And that is quite welcome because to date, food system has been largely left out of the UN negotiations, despite the fact that food contributes a third of greenhouse gas emissions. Now, there is some skepticism that because the UAE is a petrostate, as a diversion tactic. And for us as the Global Alliance, we will rather spin it the positive way by saying, how do we leverage the attention, right? How do we make sure that irrespective of the priorities, be it health, be it food, that we are diverting, making sure that fossil fuel phase out is high on the agenda. And I'll come to that in a bit, but I wanted to highlight that there will be 3 pavilions at COP this year for some of you that will be attending or joining online. We have the Food Systems Pavilion, which is hosted by EIT Food and other co-hosts, and the Global Alliance for the Future of Food is also one of the co-hosts. We have Food for Climate Pavilion that is led by ProVeg. I see somebody from ProVeg is also on the call today. We have the Food and Agriculture Pavilion, which is hosted by the FAO, IFAD, the CG Group, and the Rockefeller Foundation. And also there are several declarations, several letters already published, but also in circulation. There is one called the Non-State Actor Food Systems Letter that is being led by the climate champions. And that has a lot of wording around health, around food, and around climate, making sure that governments have high ambition around food. One other thing I wanted to flag here is that irrespective of wherever we come from, we all acknowledge that fossil fuel is the biggest driver of climate change. Therefore, we need to ensure that our messaging is aligned, be it from a health perspective, for those who are advocating for clean air, clean cooking, general climate change. We need to make sure that our messaging at COP this year is consistent. And that is because, as we all know, as I mentioned earlier, the UAE is a petrostate, and phase out of fossil fuel is not talked about as much as it needs to. So let's make sure that our messaging is aligned. And this is important. And one of the reasons why we are publishing the report around power shift, why we need to wean industrial food systems off fossil fuel. Now, if we have time, which we might not have, I'm going to show another slide that shows the various intersections. And we're launching this report in 2 days' time on the 2nd of November. And then we'll also have a public webinar. I'll put the link in the chat after I'm done speaking. But one of the things we found in this report is that our food system is currently a significant user of fossil fuels. And also, the energy intensity is growing, and is growing for various reasons. One of the reasons is increased mechanization, excessive use of fertilizers and pesticides. For some of you who do not know, fossil fuels are one of the raw materials for production of fertilizers and other pesticides. And for some of you on the call today, you're also advocates for worker safety, exposure to petrochemicals and pesticides. So the question here is, how do we align our messaging and advocacy together? Another reason why we're having a growing intensity is the growing demand for meat and dairy. The speakers before me have talked about this, and also ultra-processed foods. Now, the more you process your food, the more you have a need for more energy. And this is locking in our system into fossil fuels. So how do we ensure that we're moving our food systems away from that? Now, the image on the right just shows us the various intersections between environment, social, economic, how all of that relates to food and fossil fuels, as well as health and climate. And all of this is in the report that we'll be publishing in 2 days' time. Now, in the interest of time, the slide that I'm going to show you is quite a busy slide. So it needs you to take your time to look through the various negative, but also our report shows the positive intersections. Now, you will see here, like I mentioned, things like worker safety around pesticides, but also as we're recommending the transition towards renewables, let's bear in mind that there might be unintended consequences. Now we are seeing things like bioenergy where it's locking in industrial livestock production, because when you fit in a biodigester, you need the manure to feed in methane into the system. So how do we make sure that our quest for renewables and that transition doesn't create other unintended consequences? So we'll look at that in detail in our report. As well, this other slide just shows some of the recommendations we believe are opportunities, no regret opportunities, and we acknowledge there will always be trade-offs, but we've identified these opportunities by speaking to several stakeholders. One of these opportunities include phasing out fossil fuel-based agrochemicals and taking on more agroecological practices, and also utilizing renewables whilst reducing the energy intensity, and also reducing our animal source food consumption and shifting towards plant-rich and minimally processed foods. Now, I'm going to highlight this because a lot of the solutions that we are promoting to some extent are highly processed meat substitutes. And how do we make sure that we align our messaging around, we need to shift from animal source foods, but let's ensure we're shifting towards minimally processed plant-rich foods that are not highly processed. So I'll leave it at that, and I'm looking forward to many of you joining our webinar on the 14th. Thanks.
Thank you, Vivian.
Jenny, can you hear me?
Yes.
Yes.
Thank you. And we will look for ways to make sure that report is shared with the attendees at this meeting and at our other methane events that we've hosted. Okay, I'm now going to turn over to Milena Sergieva to run a poll because we'd like to get all of your input on some of these ideas and solutions. Milena?
Good morning, everyone, and good afternoon for those of you based in Europe. Can you see the poll now?
Yes.
Yes. So we would like to ask you which strategies around food, methane mitigation, and health you see as most urgent or most promising, and which ones are those who you would engage with. So take your time to read, as the answers are a bit long. We'll give you a couple of minutes. Okay, we have more than 70% of votes, and I can see that the strategy to promote diets that are low emissions, nutritious, and healthy, and affordable and accessible in your hospital, clinic, or agency is the most preferred one. Then the next one is to promote local policies and actions which provide communities with food sovereignty. And the two that closely follow are inform patients about the health impacts of agricultural air pollutants and methods to reduce or prevent harm, and push one's country to include methane mitigation and its health benefits in their national climate commitments. But overall, it seems that all of the strategies make sense and are seen as feasible for some of you. So thank you so much for providing your answers.
Thank you, Milena, and thanks everyone for taking the poll. And we're going to be coming out with a survey to everyone who has expressed interest in methane mitigation and health by attending our workshops, these briefings, or indicating in your kind of sign up to GCHA's mailings and whatnot that you were interested in these issues, to find out amongst the strategies in each of the sectors, which are sort of the top two or three that you would like us to develop a policy brief or fact sheet on, and then we'll reach out to you to get input in that development of those tools. So that'll be coming out in the next couple of weeks sometime. I'd also like to remind everyone that there is one more in this series of 3 short briefings on methane mitigation and health that will be coming up next week on November 7th. It focuses on waste, methane, and health, which is the third big area of human-caused methane emissions. It's at a different time. We wanted to rotate a bit to catch different time zones. So take a look at that for that. The information is posted in the chat, and we'll send it out as well following this, this session. I'd like to thank all our speakers, and we're going to close, if we can pull this off, by sharing a short, very, very short video. Milena, are we able to screen that video? So unfortunately, we were not able to hear the sound on that, but that is a quote from one of the folks interviewed for our reports. And we'll have some of these short quote videos coming out as well in the next few weeks. Thank you everyone for joining. Thank you especially to our speakers for excellent presentations. And we hope that this short briefing was helpful and interesting. Have a great rest of your day.